Are you able to name the diagnosis? Hi, Dr. Scott Davis, physical therapist, and I've got a quiz, easy edition. The patient is a 38-year-old male who presents with right shoulder pain. The patient indicates that the pain has been going on for about 3 weeks. He indicates that he is right-handed. He states that he was having pain for several days that was quite intense, and he took a few days off to rest. He indicates that during his time off, his shoulder began to feel better, but when he returned to work, the pain was exacerbated. The patient indicates that he is relatively healthy. He has mild hypertension, for which he controls that primarily through diet. Otherwise, the patient is not taking any medication. Upon physical examination, the patient has full active range of motion, but he reports that he has pain in a range of about 70 to 150 degrees on the right. The patient has 5 out of 5 strength of all muscles in and about the shoulder. The patient has a negative apprehension sign. The patient has a negative anterior drawer test. The patient has a negative load and shift test. The patient is noted to have a negative drop arm test, and he is noted to have a negative external rotation lag sign. The patient is primarily tender just below the anterior aspect of his acromion as it progresses over to his coracoid process. The patient is negative for any tenderness in and about the biceps tendon or the bicipital tuberosity. Which of the following is the most likely diagnosis? The correct answer in this case is impingement syndrome. The patient is showing full range of motion, but he does have a painful arc. The patient is noted to have good strength. He has no signs of a rotator cuff tear. He is having no popping or clicking within the joint that might suggest intra-articular derangement, such as a labral tear, a Bankart tear, or a slap tear. The patient is showing no signs or symptoms of bicipital tendinitis or bicipital subluxation. Given the patient's overall presentation, the location of his tenderness, the most likely diagnosis is impingement syndrome.